Hello, this is Dr. Cicala from Balanced Living Chiropractic. What you're looking at is two nasium films, which are frontal views of the head and the neck. This is of a patient pre and post care. We're going to go over some case studies and explain what we can do for people and what the benefits of upper cervical chiropractic are. And so if we look at this film right here on the left, what we're seeing here is down here, if you look at the cursor, that is going to be the neck. If we look at the head, this cursor now, that's going to be the head, and we're seeing the two eyes here, and then this is the nose right about here. This green dotted line, that's going to be our vertical axis. That's where we want the yellow lines to be that are going vertical, and then the line coming across here, that's going to be our horizontal line. This line down here, that is now purple, or it should be purple. This line where the cursor is, that is going to be representing the neck. This line now is going to be the head, and the one coming across is going to be the top bone of the spine. For this patient, you can see the neck is severely off to the left, and then the head is coming back off to the right. And basically what that does is it creates a very large pinch right where our cursor is here. That's where the brainstem sits, and the brainstem is your main control center of your body. And so when there is pressure on the brainstem, it can cause a lot of issues going on in the body, because now the brain cannot communicate correctly with the rest of the body and the nerves are pinched. And so what we did here on this patient is we did the analysis and found out how to adjust this person. And then if we look over here on the right side of the film, this is that same person after one adjustment. You can see how much straighter that this person is. Now, a little background on this patient. This patient has rheumatoid arthritis, which has been flaring up worse over the last year or so. Also, it's dependent on diet and stress. So this is this patient's before and after films after one adjustment. The patient reported that she was in a lot of pain after that first adjustment, and that's because of how much movement we've gotten with the head, neck, and now those nerves need to adapt. But after a few days of her body adapting to this new position, she's already starting to notice improvements with her body, with her functions, less pain going on in her neck and her wrist and her hands and her feet, which were mainly where the issues are. So if you are a person out there with some type of dysfunction going on in your body, and no one else can figure out what's going on with it, and no one looked at your upper neck, I would suggest you come in so we can take a look and see, are you looking like this, and can we make you look like this over here to make you better. Call us 248-652-7225. This is Dr. Cicala from Balanced Living Chiropractic.